They say knowledge is power, but you need the wisdom to understand what this actually means. Welcome to the Decoding Health podcast. I am your host, Dr. Urban A. Kiernan. Each week, we will share the stage with renowned experts as we dismantle the black box of knowledge and unravel the complexities of science and its practical applications in our daily life. This show is committed to illuminating topics ranging from personal health and wellness to cutting-edge biopharmaceutical advancements and beyond. Let's get started.
Individuals looking to unlock their true potential should look no further than Restore Health AZ. Whether someone is an elite athlete or a high performer in their industry, Restore Health AZ is there to help them reach new heights. Their groundbreaking restorative injection therapy and anti-aging precision medicine are designed to rebuild health naturally. At Restore Health AZ, they believe in the power of biohacking and regenerative therapies to optimize performance and longevity. Their innovative approach includes treatments like V-cell therapy, which harnesses very small embryonic-like stem cells to promote tissue repair and rejuvenation from within. For those who won't let pain hold them back, Restore Health AZ offers a solution. Interested individuals can visit restorehealthaz.com to take a pain quiz and get a free 10-minute consult with one of their experts. They can experience the future of medicine and revitalize their performance with Restore Health AZ.
Welcome to another episode of the Decoding Health podcast. I am your host, Dr. Urban Kiernan. We've got a very special guest today. We're talking about chiropractic, and this is a huge area of health medicine that is largely ignored by the mainstream, but of absolutely tremendous value. So I'm just going to jump right into it. Dr. Keith Lavender. He is the founder and grand poobah at Foresight Chiropractic, located in Gilbert, Arizona. Welcome to the show. So
Glad to be here. Thank you so much.
Let's just get into this. How did you get into chiropractic?
Oh, that's a great story. You sure want me to go through all of it?
Absolutely.
I started off in my educational career going into electrical engineering. I love engineering. I love math. And so I took a lot of classes, all the math prerequisites from Mesa Community College and ASU, with the intention to go into electrical engineering. And during that time, I had gotten married, and about 6 months into our marriage, my wife noticed this guy's always having migraine headaches. Every weekend he's got a migraine headache.
You?
Yeah, me. And she started dropping hints like, "Hey, you ought to go see my chiropractor." I thought, "You're crazy. No one's ever going to crack my neck. I'm not going to let anybody touch my neck." That's stuff you see in the movies, right? And after her, just regularly encouraging me to go see her chiropractor, I finally broke down and said, "Okay, where's your chiropractor? I'll go see her." And we lived in Gilbert, actually Mesa, Gilbert Road in Southern. And there was probably 5 or 6 chiropractors within a stone's throw of where we lived. And I said, "Well, which chiropractor do I go see?" She said, "Well, you got to go see my chiropractor." And I'm like, "Okay, I'll go see your chiropractor." My intention was just to go to get off my back, to say I tried it, it didn't work, and leave me alone. Let me do my own thing. I'll keep taking the Tylenol and everything. So she said, "We got to go see my chiropractor, who is in 51st Avenue in Northern." Basically, it was about an hour drive at 55 miles an hour on the freeway at that time. And I'm thinking, "Why do you want me to go all the way over to see your chiropractor?" And she said, "Well, you got to make sure that you're seeing the right chiropractor, and because I know the kind of work that she does, which at the time was upper cervical work." And I said, "Okay, I'll go over there." I was a full-time student. I was working full-time. Didn't have a lot of extra time in my schedule, but I thought, "Okay, I'll go over there and I'll try it. I'll try it one time." So we scheduled it, went over there, and number one thing I didn't want is I didn't want anybody cracking my neck. And because I'd seen all the stuff, and I just was freaked out about it. I didn't know that it was really safe when it's done properly, right? So I walked into this office, and this little woman, her name's Dr. Lord, maybe weighed 115 pounds, that's it. And I thought, okay, there's no way she can break my neck. So she started testing me, and she said, "Hey, what's going on with you?" And I told her, I said, "Hey, I have real bad neck pain, migraines regularly, and my back hurts. If I turn my head real far to the left, I get an immediate just sharp searing pain in my left side of my neck. And I also have asthma and had it since I was 2 years old." And she's like, "Okay," and checks me out and checks my leg lengths and took some x-rays. And after that initial visit, probably took us about an hour and a half, she said at the end, "Hey, come back in a week and I'll have these x-rays developed." And I thought, "You're crazy. I just drove out here for this. I was expecting to have you do whatever you do and fix me and not have to come back. And I was hoping my insurance would cover it. So I had no expectation, no realistic expectation of anything about healthcare. I was about 22 years old at the time. And so I said, okay, I'll come back one more time and see what you can do for me. Came back, she showed me my x-rays, and my neck, instead of having a normal curve to it, at 22, it was a complete reverse curve, the kind that you get in a whiplash trauma. And I had several whiplashes as a kid. And she's like, hey, Keith, I don't know if this is causing your headaches, but this isn't right. Your neck should be curving this way. That's normal anatomy and normal alignment. And if I can help you get your neck back to that curvature, there's a good chance that all the little delicate nerve structures in your neck will work better and your headache might get better. And I thought, well, let's give it a shot. There's no drugs involved. There's no surgeries involved. So she put me on this table and gave me this very, very light adjustment. It was so light that by the time she was done, I was wishing she cracked my neck. Like, I didn't think I got anything out of it. I was like, are you kidding me? Just crack my neck, do something. And she did her thing on my neck, and I thought on my way out of her office, okay, I came, I tried it, this was a joke. It kind of made sense about the alignment of my spine, and she started talking to me about coming back 3 times a week for the next 4 months, and then 2 times a week after that for 3 months. And I told you I was going into doing a lot of math at the time, and I'm adding up on my mind $35 times 3 times 4 times 4, and I thought, this is crazy. We had no money, and I thought as I left her office, I'm never coming back. I tried it. Okay, I'm done. I'll move on to the next thing. And then as I went outside to get in my car, I put my car in reverse, and I turned my head left to check behind me, and my head just floated. It was just like somebody had greased my neck, and I could turn my head far without that neck pain. And as I looked up out of my windshield, in front of my car was this beautiful orange tree. And the oranges were just vibrant orange, and the leaves were just this vibrant green that I didn't notice when I went in. I thought, these chiropractors are weird. I go to Mexico all the time, and I cross the border, and these kids come out and start cleaning my windshield. And I said, these chiropractors are the same way. They're cleaning my windshield when I'm in there getting adjusted. And I thought, this is crazy because I could see so clearly. And all the way home, I had an hour drive back home. All the way home, I'm thinking to myself, I didn't know where my head should be on top of my neck. It just felt like it was floating. And my vision had improved. And I thought, this is wild. I didn't know what she did in that room, but she did something natural to possibly realign my spine in a better position, a position that's supposed to be in. And so I went back because I noticed after a couple of days I wasn't having the headaches, but went back to work, ended up having headaches again, and I went back and she checked me, and sure enough, I needed to be adjusted again. And going back and back and back over the course of the next few weeks, I would sit in her office and I'd be waiting for my turn, and people would drag their loved ones in. They'd carry their loved ones in, and they'd go in this back room. She would do her thing, and these people would walk out happy and smiling. I thought, what in the world is this chiropractic stuff all about? This is crazy. So that was my first that was my first exposure to an upper cervical chiropractic practice. And after I had my changes over time, after about 6 months, I noticed that my asthma was getting better. I was sleeping better. I wasn't shaking all the time. And my life just slowly got better. And I thought, there's got to be something to this that I need to check out.
Okay, so I'm going to interrupt you
sorry.
there. This is no, don't apologize. This is your story. It's a great story, and I'm sitting over here smiling and chuckling because I can 100% relate to everything that you're saying. But there was a lot that was said right there, and I know a lot of the audience have that exact same preconceived notion that you had from the get-go. It's a sham. I'm not going to get anything out of it. Stop bothering me. I'm just going to go and do this for you, dear wife. Just back off. Zero expectation whatsoever. But at least you went and it worked for you.
Right.
Now, you keep on mentioning upper cervical. Your wife even mentioned, there were 5 stones throw from where you live. No. You need to go across town to go and see my person. Okay. Yeah. So please enlighten all of us. Chiropractic medicine is just this gross general term. And there are different schools underneath. It all began under Dr. Palmer up in Illinois, and we'll That's what the picture that you're seeing right now on the screen is, old black and white.
Yeah, that's Dr. B.J. Palmer delivering an upper cervical adjustment
Yeah, and it
in
was
Davenport, Iowa.
yeah, and his first patient was actually the janitor from, I remember that,
Yeah,
Lord.
that was his father, Dr. David Palmer. Yeah, the first where they discovered chiropractic was adjusting a janitor who couldn't hear. And they adjusted him on just a flat wood bench and just racked his upper thoracic spine as hard as he could because he found a vertebrae a little twisted. Thought, well, hey, if it twisted and it came out of line, I'm just going to push it back to where it should go. And he just jammed it over there and he could start hearing again.
And that type of story, that snap, crackle, pop, is what most people associate with chiropractic. But I'm going to turn it back over to you. What are the different schools of thought, of practice, that fit under chiropractic? What are the value of each one? And then we'll get back to your particular story, because yours is very upper cervical. And just so everybody knows, when you're talking about the cervical spine, we're talking about the neck. Then you've got your, the other parts at the back would be the...
Yeah, you've got your cervical spine. You have below that your rib cage, your thoracic spine, and then your lower back, your lumbar spine.
Gotcha.
Yeah.
And each is extremely important for different parts of health, but enlighten us, different schools of chiro.
So, chiropractic in and of itself, it's a philosophy of healthcare. It's a science of application, and it's an art. And every chiropractor, the art of chiropractic, the technique, if you will, is as varied as there are human beings who practice it, right? So everybody wants to apply their best tools to help a person improve their health and well-being naturally. So there's one school of thought that is upper cervical, where, of course, the control of your body starts at your brain, your spinal cord, and any upper cervical misalignment has the potential to affect everything below the neck. So that's the type of chiropractic that I was exposed to at that time. And then there's a segmental type of chiropractic where we're looking at every part of every vertebral joint of the spine coming all the way down. And there's doctors who focus on the whole spine in that way. And then there's tonal modalities of chiropractic. We're looking at muscle tone and the afferent, or the information coming into the brain, making a change on that information coming into the brain. The brain will make a change in the structure coming back out as how it controls the muscles. So all these different views of looking at how we can come in here and make a change in the nervous system is to me, it's kind of circuitous. Pick your entry point, make a change, and see how the body wants to adapt to that change.
Gotcha. So in my personal story, that 21 years old, that's when I started chiropractic. Lower back jacked up from life, judo, was having a hard time walking. My first exposure was to a style called Gonstead. And this is you explained it.
Yeah. So Gonstead is a very, it's very systematized approach, taking x-rays, looking at alignment of the spine and making corrections in the spine, only in the areas that need to be corrected, not just pushing everything and hoping something pops. So it's a very precise technique also that can be applied to get the rest of the spine moving properly. Yeah, and it really looks at the whole spine segment.
So now I would define, and correct me if I'm wrong, Gonstead as being a very heavy type approach to an adjustment. Every Gonstead practitioner, and I don't mean to stereotype here, every Gonstead practitioner that I've encountered has been a bigger individual, because when they are going to adjust that joint, they are generating a tremendous amount of force in order to get that joint moved. And obviously that's bigger the better. You wind up with that big characteristic pop that everybody associates with chiropractic.
Yeah.
But that is not a one size fits all. Like you were afraid of somebody adjusting your neck, and you were actually underwhelmed by the adjustment that you had. And it's like, well, somebody do something. I drove all this way. Somebody go and actually do something. But, I've posted videos. Like, I also go see Gonstead in my personal life and absolutely love it and endorse it for those particular needs. Now, putting
Absolutely.
adjustments on video and showing people, and then the neck adjustment, and even in my Brazilian Jiu-Jitsu community, very tough individuals, they're like, hell no, I'm not letting somebody do that. Was
Yeah.
that your thought regarding going in, the just natural fear?
Yeah, just a natural fear, and having someone do that to my neck, and not understanding, right, that these people are trained, they've done this 100 times, thousands of times, they know exactly what they're doing to not damage anything.
Gotcha.
Yeah.
And don't take us wrong, there have been negative incidences involving chiropractic reported, whether it was directly caused by the chiropractic or if there was underlying issues that nobody was aware of, and it exacerbated the problem. But that's a risk of just healthcare
Yeah,
in
right.
general. It could happen.
Yeah,
It
people
could
with
happen.
neck pain, they go to a chiropractor for help. They don't just show up without any reasons, right? So they're usually there already. The event may be happening.
Correct. And we'll get into some other points with that from a prophylactic, a preventative medicine type approach. But a lot of people watch like action films, and they've seen like Arnold Schwarzenegger go and grab somebody and just twist their head, and that
Yeah, that's not going to happen in reality. No.
Gotcha.
You have strongest ligaments of your spine, strongest ligaments of your body are upper cervical ligaments, right? And they are there to hold everything in nice tight spots. Now, when people have injuries or accidents, car accidents, hits to the head, traumatic brain injury, right? Those ligaments can become stretched or even totally broken, and then there becomes an instability issue up there, right? But for the most majority of people, there's not a problem with it.
Gotcha. So unless they did like an exorcist type move where the head goes like all the way, or like even a 180-degree turn where your face is looking backwards.
I think in that instant, as in jiu-jitsu, your body's going to follow your head real fast, right? That person's body is going to catch up to their head. I always like to laugh. It's just everything follows the head. If you take a little child that's just learning how to walk, you grab them by the big old head, and you just turn them a little bit, their body's going to follow that head wherever it goes. So I think if you're putting somebody in that position that quick, someone's going to flip around on you or tap out.
Yeah, it's called a cross face.
It's called a cross face.
There's a reason why you do that. Where the head goes, the body follows. That's a very, very simple premise. So here you have this situation in which you had skepticism regarding the very thing that you went into as your profession. You were predicated on ignorance. You were afraid of getting hurt. You went in, you were confused as to what was done. But at the end of the day, there was something that was better towards the positive. So how does that experience from treatment, taking techniques that originated back like in the 1800s, that's when all of that took place with, correct me if timeline wise, it was in the late
1895 was a quote unquote discovery of chiropractic. Yeah.
Gotcha. How does that translate into you no longer wanting to be an engineer?
Oh, gotcha. Okay. Yeah. So, I was going to school with an engineer in engineering where I was at. I look around the room, people are working on their, their computers and super smart. I'm like, this doesn't fit me. I'm not as smart as these guys. And I couldn't imagine myself enjoying a life of work where I was stuck in a cubicle doing this stuff without any social interaction. And I realized, okay, this isn't for me. But at the same time, one of my friends said, hey, you ought to take an anatomy and physiology class so you can understand how the body works. And I thought, well, that makes sense. I'm going to college. Why wouldn't I want to get a good rounded education? So I started taking an anatomy class, and I found out I really loved it. And I really started diving into the anatomy of the upper cervical spine, the nervous system. My father was an electrician by trade. I grew up working for him. I understand how electricity worked, how wires worked, and I just became really enthralled in the idea that and as my whole life growing up, I grew up in a medicine cabinet, I call it. If I was ever sick, you take this drug, this pill, this powder, this potion to cover up a symptom. At the time, I didn't realize that. I just did what my parents told me to. But the idea of that my body should be able to heal naturally if there's no interference to the process, and who's telling me if there's any interference, and where is that interference, and what can I do to get rid of it? Right. So that started making some logical sense to me that, hey, let's make sure my body's in good shape before I start putting a bunch of medications that ruin my quality of life. And so I decided, okay, let's start doing some more anatomy and physiology classes. Over the time of visiting this chiropractor, she started explaining to me a little bit more about the nuts and bolts of how this whole nervous system works and how the body is self-healing and self-regulating, and that it's designed to be healthy. We just got to try not to screw it up, you know? And so after I had started down that road in anatomy and physiology, I thought, this is great. This woman, she ran her whole office by herself. She was probably 65 years old at the time, and she had a ton of energy, vitality, and you could tell she loved working every single day. And I remember thinking, as I sat in her office one day, man, if I could live my life where I could help humanity and help people improve their health and well-being naturally without drugs and surgery, and that would be a life fulfilled. And I thought, okay, I'm going to try this thing, even though I hate the idea of going to a cadaver lab and, you know, seeing blood and all the steps that it required me to become a doctor of chiropractic. That, well, you know, it might be worth it if I check this out a little bit.
Gotcha.
So, yeah, that's when I decided, okay, how to go to the Fountainhead, Palmer College of Chiropractic back in the day, and enrolled in 1996.
Awesome.
Yeah.
So now you are on this journey, and you went to a Palmer school. So now the school of thought that the doctor that introduced you to chiropractic, and now what you practice on your own, what specific set is that?
Okay, so I went to chiropractic school expecting that chiropractic in my mind was not this popping and cracking stuff that I had seen, but it was all this upper cervical. I was wanting to go to Palmer College of Chiropractic to learn how to adjust the upper cervical spine, the Atlas. And when I got to school, even before I was registered as a student, on campus I met some people. They invited me to their house, and they started teaching me how you can palpate, feel the neck, and how you could not only crack the neck, but you can crack every joint of the body. And I thought, wow, this is amazing. And I started learning what's called motion palpation, you know, how to feel the end of the joints and make sure everything's moving properly. And after being adjusted as students at chiropractic college, you are the guinea pigs for those who are ready to graduate. And so you're just fresh meat. Other students who are ahead of you in the progression get to work on you, get to palpate you, and you get to experience it. So my wife and I were fully immersed, and after about five trimesters in, our health started going down. I started having more headaches. I started having all the same health problems I was having before chiropractic school. And I remember thinking, if I'm having all these health issues again, and I'm at the fountainhead of chiropractic, something's wrong. And so I traced it back to say, okay, I'm not going to let anybody touch me anymore. No one's gonna touch me. I'm just going to go back to what I knew worked, which was checking my upper cervical spine, get my head on straight, and let my body heal. And after we did that, I started getting better again, and my wife started getting better again. And I had this moment of contemplation where I thought, if I'm going to require that someone is really precise in how they adjust my upper cervical spine, then if I'm going to require that for my own health, I can't give less help than that to my patients that come to see me. So I needed to learn how to properly give an upper cervical adjustment. And so I started taking classes for what's called Atlas Orthogonal chiropractic, is the type of chiropractic I practice. And so
this is actually really interesting because even though you are a doctor of chiropractic medicine, you've experienced the bad side yourself.
Yeah.
So, but it's not a shot on the industry as a whole. Those, as a part of practice, those adjustments that you were getting were of not even of zero value to you. It was of negative value to what you were getting. You were actually putting yourself off of the norm by having these unnecessary adjustments. And in my personal experience, there are a lot of questionable chiropractic practices that are out there. And this goes back to the original point that your wife made. you need to know what's best for you. So go to mine to begin with, because if you would have went to one of the ones that were in a stone's throw away, and they would have done what you had done in your preconceived notion of what should have been done, it might not have worked. It actually might have made the problem worse, and you would never have received the benefit that you're looking for. So, long story short, everything has its particular place that you're looking for. So you focus on upper cervical, Atlas orthogonal, and those are some pretty big words.
Yeah.
Again, Atlas is your C1 and your axis is your C2. And then there's 6 cervical.
7 cervical vertebrae.
Gotcha. And we've got an image right now that's showing what those vertebrae actually look like. Now, when a person does a normal head adjustment, the snap, crackle, pop, pop and pray. Sometimes that's what it's referred to. What are the normal bones to get aligned as a part of that type of standard adjustment? That's what I will call it.
Yeah. So in that system, you are feeling for what's called end range of motion. So you're pushing the joints from C7 to C1 in through their normal range of motion, finding out which ones may be stuck or restricted. And then the adjustment is generally given at the end range of motion, where the ligaments are separated enough to where it may give a little pop or that sound that you're used to hearing. So that's an end range of motion adjustment, whereas the light adjustments that we do are all within the normal range of motion. So we're never pulling ligaments past their normal ranges.
Gotcha. But let's explain a little bit to the audience regarding anatomy, because your Atlas and axis, your C1 and C2, have very specific function and very specific ranges in direction of motion. They're not like the rest of your cervical vertebrae.
Right.
Enlighten everybody a little bit about that specificity and how those two work that, and then your basal skull work as a trio.
Mm-hmm. Yeah, so we call it the craniovertebral junction, right? So you've got this 10 to 14 pound bowling ball that's being held up by a little 2-ounce bone, your atlas, and underneath your atlas is your axis. So the atlas rotates around the axis about 45 degrees of free motion. There's no disc in between those joints. It's just a fluid-filled joint, just like the fluid in your knee. And there should be very little restriction. It just very easy to turn your head right and left. And I always tell patients, if it's not easy to turn your head right and left 45 degrees, there's probably a restriction up there. And it could mean that you have a subluxation, you're out of alignment up there. So between your skull and your atlas, there's no disc, which allows for great motion. And between your atlas and your axis, there's no disc, which again allows for the proper motion right and left. And below that, of course, then you have your vertebral discs that are going to restrict a lot of movement and give a lot of stability. So the unique thing about the upper cervical spine is there's a lot of mobility, and we are sacrificing stability for that mobility. That's why you can have a small, fall on your tailbone and your head gets whipped, and that whole area can come under stress and lock out of alignment.
Gotcha. And as you already had mentioned, the strongest ligaments in your body run through that tight little junction.
Yeah.
Right there. Mm-hmm. And have any quick comment in explaining what most of the audience listening, you guys have never heard that before. You think of big, strong things. You think of like bodybuilders and, power lifters and all of their muscles and all of these supporting structures around their big movable joints. But no, these are the 2 strongest ligaments.
Yeah, the cruciate ligament, right? That holds your atlas and your axis nice and tight in there so that atlas has a pivot point to roll around. And because right behind it is your spinal cord, right? And so nothing can touch that cord. Nothing should get into that space. Nothing should put stress on the cerebral spinal fluid around that area. So that is the most critical part of your whole body. As you know, if you break your neck, the higher up you go, your lights are out, right? You're over.
Right.
It's a done deal. So the body has to protect that. I always think it's an interesting, our body is built very interestingly, that the whole control unit of our body is way out here in space. You know, if we were making something like that, we want it to be protected in here in the gut. But we got this amazing brain that is connected, you know, down to our body through this short little neck. The smallest part of the spine is right up at the top of the neck, and it slowly gets larger as it comes down. But it's so susceptible to injury that we have to protect it.
Right. But in terms of, you just said that sacrifices stability in order to have mobility.
Mm-hmm.
In terms of mobility, in that tight little junction where it's absolutely so critical, where you go from brain into spinal cord, and we're going to elaborate a little bit further on that. It's only very specific motion. So back to the whole fear thing regarding that rotational adjustment that is so associated with chiropractic. You're through that your basal cranium, your atlas, and axis. There is very limited rotation in that particular space. It's further down your C3 through your C7 that end up doing the majority of that rotation, because your skull onto your atlas basically only moves up and down.
Yeah, right. Flexion and extension, right, on your skull.
Right.
Yeah, and then the atlas axis is strictly rotation,
Yeah.
right? Strictly rotation. And as you tilt your head to the side, it can shift right and left slightly also. But it really is all for that rotation about 45 degrees.
Gotcha. And so in terms of preventing neck injury, what you need to worry about is that movement front and back, not necessarily the twisting. And with that movement front and back, it's also that overturning sideways, like in a neck crank, or again, for my jujitsu colleagues, getting stacked on the back of your head. That is a troublesome position, because you're taking that joint, that tri joint, I'm going to call it that way. You're taking it to the end of its ability to move, and that's where that risk of damage actually comes from. It's not necessarily all of the twisting. And so now, in terms of this alignment, most people superficially know, oh, you got the spinal cord that kind of runs down, and if you break it, that's, you know, if that gets severed, that's a bad thing. The pain that people feel when they have a subluxation, and actually, very quickly, can you define for the audience that term subluxation? What exactly does that mean?
So it's a chiropractic word, subluxation, simply meaning that there's an interference to the nervous system function, right? So if a spinal joint is out of alignment enough to where it can irritate the proprioceptive, or the sense of where that spine is in space, the signals going back to the brain, there's going to be an interference in that communication process. So we want to make sure that there's no disturbance to the spine, so that there's no disturbance to the nerves.
Gotcha. And so somebody has back pain, and it is an addressable issue via chiropractic, or even a lot of the stuff before you get to the point of a neurosurgeon. You have herniated disc, bulging disc. You've got all of these different terms. You've got bone degradation, fusion that ends up occurring. But again, these are later stages of a disease. Yeah. The pain that a person feels, is that something with the spinal cord, or are those other nerves that are affected because of the subluxations?
Wow, there's so many things that could be pain generators in there, right? It could be just an overstretchment of a capsule or ligament. It could be a stretching of a nerve over a bony prominence. It could be a muscle aberration in there where the muscles have been damaged, and where the muscles attached to the vertebrae, those aren't happy. So there's a lot of different things that can cause that pain. Does that answer that
No,
question?
it does. And so my question is, if there's somebody watching this right now and they're having issues, there's like, where are they supposed to go for this? Because chiropractic medicine here in the West is one of those things that, lack of a better term, is absolutely shit on. It's misrepresented. A lot of people view chiropractic as ambulance chasers. You guys are working with the litigation attorneys for injury after a car accident, and it leaves a bad taste in somebody's mouth.
Gotcha.
You go into Western medicine, they're just going to pump you full of opioids, or let's just go and cut you, so to speak. So you've got very different schools of thought by very, very smart, educated individuals. Where should somebody begin? And what are certain things that people should key on? If you can comment on both sides, whether it be on the chiropractic side or on the neurosurgery side, that people should be aware of, questions they should ask to make sure that they're getting the best treatment for themselves, because you've experienced the bad side of chiropractic.
Yeah.
And somebody doesn't know. They might be walking off the street and it's like, man, I'm really hurting here. I want relief. And guess what? You deserve relief, but you need to know where to go.
Yeah. Yeah. So I always like to say we start with conservative chiropractic care first. And the vast majority of chiropractors are so great trained, and they're going to do a good, thorough examination and get some objective data about what's going on in your spine. For example, what's the range of motion look like? Let's take some testing. Look at the nerves that control the muscles. We call that surface EMG testing. Look at the nerves that control the organs and glands through thermography. So there's a lot of testing that chiropractors can have, along with x-rays and heart rate variability testing, to actually assess what does the nervous system function look like in that area that I might be having a problem in. And then sit back and take a objective approach about, hey, what are the least invasive things that we can approach this problem and step it up. Conservative chiropractic care first. Next thing would be side affecting drugs, and then the last thing would be irreversible surgery, of course. And so I think you have to look at that for yourself. What makes logical sense for you? So, and most chiropractors are going to do a really good job of checking that out, regardless of the technique that they use.
Gotcha. And so you just threw some techniques out there. So obviously you have your imaging out there. You've got X-ray, maybe even MRI.
X-ray, MRI, imaging,
Okay.
yeah.
And then that's really good at showing structural aspects if the a radiologist who's reading those images are educated in looking for certain things. And we'll get to that in a second. Now, you also mentioned thermography. Like, what the heck is that?
Yeah, so thermography is looking at some infrared technology that can look at the blood flow along both sides of the spine, which is controlled by the nervous system. Where the blood flows, your nervous system is allowing blood to flow or not to flow based on what the needs are of the body at the time. So you can see that along the whole aspect of the spine and get an idea where there may be some disturbance up there.
Gotcha. And we're putting up an image right now showing a pre and post, cartoon of what those thermal readouts kind of look like. And hopefully your chiropractor, when they do these types of assessments, they would be able to share these types of images or have these types of explanations, because if there's an area of damage, your body is trying to heal it. So there's inflammation, extra blood flow, increase in temperature. Just like when you're sick, you run a fever. It's like a miniature fever in these localized areas, and they do that. Now, again, this is going to be critical of your industry.
Right.
And all I want are people to be able to make good decisions on their own.
Yeah.
If you went into, just off the street, went to a chiropractor's office and they were like, they have them in airports now, like in Las Vegas, LAS. There is a chiropractic center in there, and they don't know you from Adam. And it's just like, oh, what are you feeling? Hop up in the table, and we're going to go and do stuff. What's your thought on that?
So my first thought is I hope they're doing very light work on them. I'm sure they're being very far end on the conservative side of any modality that they're applying to those patients they don't have a history with. But I think it has its place. It's really generalized. I wouldn't expect top of the line changes there. They're definitely not going to have time to do any of these testing that we're talking
Sure.
about here. It's just going to be strictly based on, hey, Phil, does it hurt here, and push here. And unfortunately, in my practice, it's been a lot of times where it hurts isn't where the problem is, especially if you're dealing with long-standing chronic problems. The pain is actually throwing people off of where the problem is located.
Okay, so explain that a little bit further, because
For example, in these surface EMG tests, in these
an EMG, what is
so
that?
it's surface electromyography. So people are familiar with the little electronic nodes that they put on the heart to look at the heart rhythm. The electricity that the heart's putting out. That's EMG, and we can do that along the spine and measure how much electricity the brain is sending out to the muscles of the spine, helping you sit in an upright position. And we know what the normal should look like, and we know what it looks like when there's an interference to those nerves also. So we can actually measure how much stress is in those nerves of the spine.
And can those measurements actually show that there's an issue and the patient be symptom free?
Yes, exactly.
Okay.
So this will not show us where they hurt, but it's going to show us how they're functioning under the surface. And they may not even notice that. Many times we'll see people come into my office who have been everywhere looking for their low back pain answer. I have low back pain. I've had massage therapy. I've had needles in there. I've had it.
Radio frequency
Radio
burn.
frequency burn, stretching, everything going on in this lower back, and MRIs and X-rays, and for sure they may show that there's a disc bulge in the back. Doesn't necessarily mean that that's the pain generator, but we see this many times, and we'll do these tests on them, and we won't see any colors in the lower back. It'll all be up in the neck, and when the head's not on straight, the brain through compensatory mechanisms is going to shift the way that whole spine balances, and the pain's going to show up in the back when the problem may be in the neck. And when we can get the problem in the neck fixed, the brain can then say, hey, we can stand up straighter. We can start getting rid of these compensatory patterns, and the pain will miraculously go away. That's one of the most difficult things we have to explain to our patients, why we're touching their neck, looking at their neck when they came in with a back problem or a foot problem.
Got you. So now, like in my personal story, I was having, when I got introduced to chiropractic in Gonstead, I was having lower back issues, and I have issues with my SI joint, L4, L5, very, very common here in the West. And at that point in time, the adjustments that I required were in that area. And so a very common thing is like sciatica. Is the origin of like sciatica and that radiating pain that you get down your butt into your leg. Is that caused by like pressure on the spinal cord? Is that caused by pressure on certain nerve roots that are emerging from the spine? These types of things, because people feel it.
Right.
And the way we are here in the West is, unless it's giving you an issue, it ain't broke, so I'm not going to go and turn around and touch it.
Yeah.
In terms of those significant the negative sensations that they're feeling.
Yeah.
Is that like a spinal cord issue, or is that
it could be. It could be a spinal cord issue. It could be a nerve root issue. It could be a glute issue. It could be just an alignment of the pelvis issue. I mean, there's lots of possibilities of where it could be coming from.
Gotcha. And you just said alignment of the pelvis. And a lot of the assessments that are done, like how does somebody assess if their pelvis is misaligned?
So one of the easiest ways is to lie on the floor, lie on your bed, and have someone look at your leg lengths. And let's see if one leg is shorter than the other leg. Something we don't really think about, but it's easily seen and anybody can do it.
Now, you're not talking about somebody born like with a deformity where one leg is longer than the other.
Right.
You're talking about
like just a functional leg length discrepancy. If you have a twisted pelvis, one leg is probably going to be shorter than the other leg.
Gotcha.
Yeah.
And how does that happen? Like, are there certain traumatic things that might happen in a person's life? Like you always see a lot of moms holding the babies and they've got that hip sticking out to kind of hold the baby
Yeah.
up. I can't imagine that that's good for one's pelvis.
Right, exactly.
Doing that. Sometimes Brazilian jiu-jitsu, I'm going to throw that out there
Can't
too.
imagine there's any bad position. in
No,
jiu-jitsu.
no, it's all comfortable. It's so relaxing being twisted into a pretzel. But nonetheless, there are certain behaviors as an adult that could lead to those types of issues.
Oh, yeah. Mm-hmm.
Are there things in childhood that people need to be aware of? Because the way I view somebody's spine, it's like a tree that's growing. You start off as a little sprout and you grow up. And if that winds up getting kinked or bent, you're going to wind up with a tree that's kinked and bent.
Yeah.
So are there things in childhood that people need to watch out for?
Yeah, for sure. I mean, look at your children, look at them from the back without their shirt on, and look at their pelvic alignment. Put your hand on one side of the pelvis, one side the other, and see if they match. If they don't match, something's wrong, and that tree is already starting to grow crooked. And you really can't tell all the time just by looking at it. But if you see these signs of a short leg or high pelvis, or their shoulders are tilted, then you want to get some help before it gets worse. They're going to need an X-ray to take a look at that deeper. The biggest thing for us is sitting. You know, the body is designed to be up and moving. The body, your brain needs movement for it to grow. And the worst thing that our kids are doing is sitting for hours playing games, sitting on the computer. Sitting is to your spine like sugar is to a diabetic, I like to say. And we just, and adults too, many of us we have a job where we sit, and we don't even get up from our job to go eat lunch. We eat lunch right at the desk and throw it away, then we continue sitting again. Then we leave our work, we sit and drive home. We go home, and what do? We sit on the couch, right? I mean, there's so much time in a sitting position that those postures cause subluxation patterns that show up.
Gotcha.
So changing those things are huge.
Gotcha. And at what age do you feel that is appropriate to begin chiropractic? It's like,
okay, good question.
Most of these ailments, like people are older, and it's one of those things that you might already be past the point of no return by the time you come into an office. That's very, very real. How young is too young?
So as soon as they're born, I've seen patients bring their babies in here within a week of being born. I've been invited to a hospital right after birth to check a baby.
Okay.
And so what I'm saying is we're not adjusting their spine per se, but we're checking them to make sure their spinal alignment is perfect right from birth.
Gotcha. And we're putting up an image right now of a forceps birth.
Oh, yeah.
I don't even know if they still do those anymore, but nonetheless, it's that birthing process, even if it's through a cesarean section, it's traumatic.
It is traumatic.
You know, the baby is going from being in a curled up little ball to the first time in its existence into a full splayed out fashion.
Yeah.
And, you try to replicate that using the papoose and everything like that and keeping them bundled up. But now their spine is in full range of movement. And so my son, who's 6 right now, you started adjusting him as well as my Gonstead provider. I'm just letting you know, we've taken him to 2 different schools of chiropractic thought. He was an infant the first time you adjusted him, and the same thing with the Gonstead. And again, it's not the same adjustments that you guys are doing to adults,
right?
Simply because it's like a little tree that's just starting to lean. You don't have to prop it up and nail stuff into it to keep it from falling over. It's just a little bit of nudging, guidance, and training.
Yeah,
that's what they call it in the plant world. You got to train the plant. You're training the child's spine, from day one. And so, long story short, from a patient expectation standpoint, again, we live in the West. Everybody's all about convenience, fast fix. That's why we've got a drug problem here. And I'm not talking about illicit drugs. I'm talking about going into your pharmacist, getting prescriptions, because all you want to do is pop a pill and this is supposed to take care of the problem. Well, opioids work in terms of feeling the pain. It's a mask regarding everything. So what should somebody's expectation being? Like in my case, first time 20, 21 years old, that was 20, 21 years of abuse. I can only imagine like me at 50 walking in for a first time to go and get checked out. Like nobody should expect that this is going to be a one and done deal.
Right. Yeah. Yeah. And really for me, chiropractic is a lifestyle. It's a health lifestyle about taking care of your spine and your nervous system for as long as you own it. And I believe, we don't start seeking things in the West until we hurt. And most of us, like you said, 20, 30 years old, our body is done compensating. It's reached the max ability that it has to compensate. And now things start breaking down. At that point, obviously, you've let things go way too long, whether you were aware of it or not. But once you gain that awareness, then you can really start looking, in concert with your healthcare provider, your chiropractor, say, hey, what's a realistic expectation that I can imagine that I should be able to see over time with my improvement? For me, when I first went to the chiropractor at 22 years old, my spine was going backwards. It was an S-shaped curve. And I can tell you it took 7 years for my S-shaped curve to become a nice C-shaped curve again. And at that point in time, significantly less headaches. I was functioning at a high level, but I did a lot of work to get there. So everybody's going to be at a different spot on what that looks like to them. But for me, it's about doing objective data to see how you're on that pathway. Are you seeing consistent improvement with the type of care that you choose to take? And if you don't, then let's find, like for me, I had a bad experience with chiropractic, but I didn't quit the profession, right? I found another provider. And just like I've never been to the dentist when I haven't left hurting more than I went in, but I don't stop going to the dentist, right? I'm going to continue taking care of my teeth. So if you're not getting the results that you want, or you think you can get better results somewhere else, go and check it out and find out what they have to offer. Maybe let somebody look at you in a way that they haven't looked at you before.
Gotcha. And at the same token, too, from a Western medicine standpoint, you might go to your GP, you have it here, take these pills, here's some muscle relaxers. Hopefully this will calm down. I'll give you a referral to a neurosurgeon. They're going to go in. Is there anything that somebody should be wary of from that aspect of medicine pushing you into an operating room to either get a discectomy, which is where they actually cut the disc and remove it, and give chiropractic a shot? Because I know the majority of Western medicine will not even suggest chiropractic as an option. Is there anything that somebody should be listening for that might be a trigger that maybe I should go get a chiropractic evaluation too?
Well, I would say that I would never jump right into surgery unless I had frank, severe pain, 10 out of 10, loss of function, couldn't move my body in the way that I normally could. I would definitely seek other opinions if you're being sent right over to that. And I would just maybe ask them, well, what do you know about chiropractic care? Or who do you have to refer me to? And some of the medical legal stuff that's going on right now, if there's a more conservative way to take care of a patient, they may actually be obligated to tell them those ways before they go to a more invasive procedure. So that's can be a slippery slope on those standards of care today.
Gotcha. No, and that's good to know. So ultimately, at the end of the day, you are responsible for your own health. So just go out and ask lots of questions. Your provider should not be upset, put off, or annoyed with the simple fact that you're asking for information. Like, I'll tell you right now, I'm probably the worst, biggest a-hole patient that Dr. Lavender has actually ever come across. And I intentionally withhold information because my view is because they do these diagnostic techniques. And even the first time I went in for Gonstead, the provider was able to identify from thermal exactly where my pain point was. Like he pushed, like he went through, and then just doing the thermal scan, he was just like, oh, it's right here. Like, yeah, thank you, Stalin.
Exactly.
Yeah, you really like to inflict pain, but I make you do your job. I intentionally withhold information and you find it. And when you find it, you hear me on the table because I normally cuss. And it's just like, it blows my mind. So go and investigate further these additional options. Again, in your particular practice, it's Axis Orthogonal.
Atlas Orthogonal.
Atlas Orthogonal approach. And there is so much behind chiropractic that you should investigate, look into, ask questions, and make sure that it is providing you with the appropriate care necessary. Again, I require a combination of both your type of treatment as well as Gonstead, and that's just me because I'm very in tune with my body. Now, my wife with her Atlas, like she can sneeze wrong and her Atlas goes out. I'm a little bit more fortunate. Like I put myself through a lot of abuse, and there's sometimes that you're very surprised that my Atlas is actually still in, and
Right.
thank God for all of that. But again, there's a tremendous amount of information that you need to root through, understand about yourself, questions to ask, and provide that. So
I think, Urban, one of the things that you said, it's all about your practitioner should be there to help you make the right decisions. And for me, the worst patient is the one who comes in and they just nod and yes, they don't ask any questions. And you start wondering, well, are they really understanding what we're talking about? And your doctor should be very comfortable with answering any questions that you have. And if they don't, or they get put off, or they don't have the time for you, that's a clue that you might be in the wrong spot, right?
Gotcha.
And for us, some of the toughest patients are the ones who come in, we check them, we adjust them, and they immediately have 100% resolution in the reason they came in. Because a lot of times they don't understand that it's not that quick for most people, right? It's usually a process of getting sick, and then it's a process of healing and getting in a better position.
Gotcha. So that goes back to the whole expectation of what's going on. So anybody who's here in the Phoenix area, where can they find you? Where can they find Foresight Chiropractic?
Okay, so yeah, we're in Gilbert at Lindsay and Baseline, and our website is foresightchiropractic.com.
And if somebody is, say, out of state, are there resources that you would recommend? Can they go to your website and find links to other educational pieces?
Yes, they can. And a global Atlas Orthogonal website is www.globalao.com, where they can look and see if there's any upper cervical Atlas Orthogonal chiropractors in their area.
Gotcha. And just by chance, if they went in for AO type adjustments and they felt that maybe I need something a little bit harder for other parts of the body, should they be able to give referrals on that? Or, if I walked into your office and I was like, man, like my SI joints, I can't get them to move, could you recommend a Gonstead?
Oh, yes. Yeah, for sure.
Okay, gotcha.
Yeah. And I often refer to other chiropractors that I know that do different techniques, because there's so many different ways that they can come in and help.
Gotcha.
Yeah.
So again, those types of information are things that you need to know, that it might not be a one-stop shop for everything. It's you need these different specialists in order to, within chiropractic medicine, in order to take care of you. So this was absolutely awesome. Dr. Lavender is going to be kind of a regular on this show. We're going to be talking more specifically around that Atlas axis junction on the next episode, and all of the signaling, not just through the spinal cord that involves that, but everything else within the CNS, the central nervous system, including cerebral spinal fluid, and the importance of the movement of that. Really looking forward to putting together all of these pieces so that you can be the best version with you. So with that said, we're going to wrap this one up, and looking forward to seeing you on the next one.
All right. Thank you, Dr. Irvin.
You got it.